Yes, you take this one, this lesson, all right? One of the most I am talking about things that you are going to see in your clinic. The one of them is the impacted wisdom teeth. The impacted, after 18, you start having patient with complaining the tooth eruption complication. The wisdom tooth, why they are called wisdom tooth? Because they think that after 18, the brain is somebody become complete and he become a use and he think well and everything. This is the reason they called wisdom teeth. It's not relating to any wisdom because some people after 25 they are becoming human. All right. So introduction. The wisdom teeth are the molars.
Sorry, just make it bigger.
Yes, sure. I'm sorry. So let's speak that wisdom tooth usually erupt after the 18 years of age till the age of 21. Usually it takes this time. Sometimes nowadays we are seeing too much people not erupting. Why? Because the jaw, the size of the teeth is more bigger than the size of the jaw. Once the last tooth is the wisdom tooth. It's erupting after 18. It don't have place to erupt. Then it's remain impacted inside the bone. So the wisdom tooth are the molars and they are the last adult teeth to erupt. There remains little space for them to grow properly, thus resulting in impacted teeth, the third molar. Not only the third molar, you will see we have nowadays, if the jaw is small, the canine is not erupting, the incisor are not erupting, it's depend, okay? If these teeth develop with proper alignment, they cause no difficulties. If it's have a space, it will erupt normally. But if the size of the jaw is small, it will not erupt. On the contrary, if it's happen be misaligned, which is seen in most cases, this cause damage to surrounding teeth, gums, jawbone, and nerves. So if the tooth is not erupt well, now we will see how it is erupting. If it is not erupting well, this is causing headache, pericoronitis, infection of the gum around, and food accumulation between the erupted tooth and the neighbor, the second molar, and dental caries is going inside and causing pulpitis for the front tooth. So if the patient doesn't come for treatment, most probably he is going to lose two teeth, the wisdom and the second molar. All right. Since they are hard to clean, and you will in your clinic you will receive many patients. They will send for me as an oral surgeon. Please, doctor, remove the wisdom tooth. It's the one causing pain of the patient. You should be careful. It's not to the doctor referring to decide. Usually, and about 80% in my practice, I found the pain is coming from the second molar because the food accumulation caused distal caries, which is invisible only in the X-ray. So you have to take the X-ray. If I remove the wisdom tooth, still the patient will have pain. Then they will say this surgeon is not good. The patient came for pain relief. So I send him back. You treat the endo for second molar, after send him for third molar surgery.
Sorry, doctor, just the caries makes pain for the...
Sure.
Just caries, huh?
No, the caries, the food accumulation, the gum around. The gum will be infected because there will be a pocket. The food will come inside and will not come out.
It makes pain for wisdom. Yes?
Sure. The area will be all inflamed and sometimes will be swelling and will be lymph node here. So since they are hard to clean by brushing or flossing because it's in the back, these teeth are more likely to get damage. Hence, to prevent future teeth and gum problem, it is essential to remove impacted wisdom teeth through surgery. Okay, so it's important. I prefer usually, look, they ask the parent always, shall we remove this tooth out or not? I will tell you something. If this tooth is causing problem, I prefer to remove it in the age when somebody is healthy, between the 20 and 35 to 40 years old, to remove this tooth. Because if you tell him no, you go, and after in the age of 50 or 60 he had problem, the patient in this age usually its immunity is weak. he cannot support surgery. Next, maybe he will be diabetic, he will have heart problem, he has blood pressure. So there is two school in the world. You have American school and the British school. So the American school say it's better you remove the teeth in the young age because his immunity is good and he can tolerate the surgery and everything. The British school say if you see a dog sleeping, don't approach to him. You don't know, maybe he will bite you. So my experience in life, I will tell you, if a tooth is causing problem, it's better you remove it, take it out. And if you see the tooth which is it's not causing any pain and it is impacted and it's very close to the nerve and the lingual nerve and you will have chance to damage the frontal teeth and will cause a problem for you. The tooth is quiet and not doing anything, just keep him under observation. Don't approach him because really sometimes this surgery is difficult for us as a surgeon because after extraction I may damage the lingual nerve and the patient start having numbness, he was not having anything before. Or I will hurt the frontal teeth or the lingual nerve will be damaged and he will not feel his tongue. Movement will be normal, but always he will bite his tongue and the taste also he will lose it. So it's better not to approach for difficult cases which is not doing anything. But if it's causing problem to the patient, I have to worry him that this tooth is close to the nerve and this may happen, and I will take consent from the patient that I informed him, because if he go and complain later, you already be safe side. I already put you in the that this tooth it is going to cause a problem for you. So postponing the process of surgical extraction lead to further growth of tooth root that run around sensitive facial nerve, thereby increasing the risk of complication. You see? Look, it's better to remove the tooth at the age of 17 or before the root is formed. If the root is formed, usually the wisdom teeth is going to be curved and will become, the fracture of the root will become more complicated. But if the root is not formed, this case is, you are happy that you can maneuver, you can work with the tooth, it will move without root fracture. Okay? So before root completed, removal is better. Okay, we'll go next.
Sorry, doctor.
Next one? Yes, you ask.
My friend went to extract the wisdom teeth, but the doctor said I can extract it for you because it is sitting on the nerve.
Exactly. You are going to speak about it. This case, but it is not, look, if it, in this case, if it is close to the nerve, usually I send him to CT scan. Now the 3D dimension, it will show me the wisdom tooth. Some look in panorama X-ray or in this simple X-ray, you will see it like this. This is 2D, 2-dimension. But in 3-dimension, you will know this is the roots. Okay, the tooth. It is here, or it is here, or it is here. This is the nerve. So if the nerve is here, sure, during extraction you are going to hurt it, and he will not feel the
If
lip.
you extract it, you get paralyzed of this.
Not paralyzed. He will not feel. This area will be all anesthetized, like somebody received injection. He put his hand, he cannot. He will bite his lips, but the movement and speak and everything is normal. If the tongue nerve is hurt during extraction, he will bite his tongue. He will not feel comfortable. Everything. He will not feel good. If the lower inferior alveolar nerve is hurt, then you know the nerve come inside the canal and go out through the mental nerve, which give innervation to the lower lip. Then here will be anesthetized, he cannot feel, and he will bite during eating his lip. All right? So the next one, this one, we go up. Exactly, good. So why to extract the impacted wisdom tooth? Why we have to, see, this is angular impaction. This is the gum, this is the bone. So this is angular impaction. This is partial eruption. That partial, it means the crown came out the side, the bone slightly. but it cannot come totally out because this one is for, not allowing the tooth to erupt normally. This is a vertical impaction. Vertical, it is like this. The horizontal is one of the difficult, which is coming like this. So I will.
But for
Yes. So to prevent, why to extract the impacted wisdom tooth? Why this question? All the families will come to your clinic, ask you why I have to take it out. To prevent tooth crowding due to angular, vertical, horizontal, or partial eruption. We receive many patients from the orthodontist. At the age of 13, once the canine is erupted, the patient have to go to orthodontist if he have malocclusion. The orthodontist will decide, is this crowding, there is wisdom teeth still not erupted and need extraction, they send us to do surgery before they start putting the brackets, all right? Or they will ask to remove the second premolar usually, after the canine, the 4 premolars, okay? The 14, the 24, 34, 44. How they decide which tooth should be removed, they have to do a cephalometric study. The cephalometric study, they took one panorama and one cephalometric. On cephalometric study, the orthodontist decide this jaw, how much space he have, and once he put the teeth on the arc, is it this space is enough or not? Then he will decide, if I remove the premolars, he will measure on the x-ray. If I remove the premolars, the other teeth will accumulate on the jaw or not. Sometimes they ask us to remove the wisdom and the first premolar, if the jaw is small. Or one tooth, or no need. He say, leave it at the age of 17, 16, 18, we'll remove the other one, okay? So usually the orthodontist will guide us what to do. But if there is a pain and the swelling and causing headache and problem, it's to the surgeon to decide what I have to do. We have not to wait to the orthodontist, okay? So this is the crowding we talk with. To prevent swollen and painful gum. The gum, which once it is erupt, what will happen? The food will go inside here, in the pocket. The brush will not go there. If the food accumulate here, the bacteria will grow inside and will start the infection going inside the bone, and the lymph node here all will be swollen, and the infection which is gone in the masseter muscle, you know, the zygomatic bone and the angle, there is the masseter which is open and the closed, and the buccinator muscle which is here, the bone, the infection will go inside and trismus will happen. The patient cannot open his mouth because of infection. It's very painful infection. Then we have to control by antibiotics, do muscle exercise. Once he start opening his mouth, he should go for surgery because it will repeat again. Next time, if we treat it by tablet, next time we have to give injection for him to treat this case. So, to prevent tooth decay due to infective, you know, the food when it is accumulated here in this area or in this area, the food, what will happen? The dental caries will happen in this tooth, the frontal one. He cannot brush nicely, he cannot use dental floss, so this one also need endodontic treatment. If the caries is very big, then he will lose this, both of them, all right? So, to prevent tooth decay due to infective brushing and flossing, he cannot do that. To prevent various dental problems as consequence prevent the risk of all future dental health complications. I told you if the infection will go to the blood and cause septicemia, it's very. I saw patients who have fever, it's a difficult problem, okay? So, symptoms of impacted wisdom teeth. How we know this patient is suffering of wisdom tooth? He will come to your clinic putting his hand like this. You look, his age is about, should be over 18 usually. He had bad breath. Why? Because the infection is anaerobics infection. You will anaerobics, yes. You will smell bad smell coming from his oral cavity when he speak. He had pain in the ear because this area is attached with the
Sticking.
yes, with a small fiber which give pain to the ear. Also, you study it. It's a facial branch attached with the auditory nerve. He will have headache also. He cannot swallow because of a swelling was distributed to the pharynx, larynx also. A bleeding gum, he will have bleeding from the gum always. Unpleasant taste of the mouth. You know the infection which is coming with the saliva, the pus which is distributing out. The taste is very bad. Difficulty to open the mouth because of the infection going inside the bone, and the muscles function stopped. The fibers movement stopped. Cannot open the mouth. The swallow, jaw surrounding and glands. The swallow, it means edema in this area. The lymph node, if you put on the submaxillary area, he will tell you, I have pain. He will not let you touch. There can be asymptomatic wisdom teeth present that do not showcase any symptoms. Also, we have patients with, as I told you, the wisdom teeth is not erupted, but is not causing any problem. The question is in this, shall we remove it or shall we wait for happening a problem? I told you, if the eruption is acceptable for the surgeon, go for surgery. But if you have doubt that you will, about 20 or 30% you are going to cause a problem for the patient, don't do the surgery. If the tooth is asymptomatic, all right? So complication associated with removal and non-removal wisdom tooth. What complication is telling? On removal of impacted wisdom tooth, remember, in surgical extraction we have about, from 10 extraction we have 3 dry socket, we say for it. The dry socket, still till now we don't know why this is happening in the literature. But we expect that the blood accumulation in the wound was not completely formed. So the collagen and the fibers is not well united. The bone is exposed and started having severe pain. Usually we treated these cases by applying some oginol with gauze inside, or there is some medication like Eudoform. There is medicine in the market, just you put in the alveolar bone, 2-3 times by changing, it will return back. Some doctors, they prefer to curate the area, wash with normal saline. So about from 10, about 3 after surgical extraction did. In normal extraction, 1 of 10 could be happen. This one is called dry socket or wet socket, but the dry socket is more happening in our work. The nerve damage, if now we are going to see, if the root is completed and the nerve is very close or very here and the apex is broken and you try to take the apex out, you may damage the nerve. It depends. If you totally cut, then sure there will be numbness in the lower limb. If it is injured, there is a chance to reform, and this take time, usually about 2 months to 4 months, sometimes 6 months. And this is called paresthesia. Paresthesia is calling it's numbness, like you are received injection, local anesthesia. This paresthesia, if after a few weeks the patient will tell you, I am feeling some electric movement, this is very nice sign that the nerve is trying to reunite and reform. It will come first, if numbness is in the lip, it will be like take a coin here. After it will come smaller, and then within maximum 6 months it will disappear. After 6 months, if still the patient complaining of numbness, the hope will come less. There is no hope. How we treat these cases? Usually we send to the neurosurgeon by doing microscope surgery. They took nerve from his leg or hand or somewhere, and they do, and the success is not too much good. Okay, so try always not to damage any nerve. You be good. Paresthesia, as I told you, he cannot feel the numbness always here. numbness or paresthesia, it's very close to us. Numbness also like a pins in the mouth. Okay. On non-removal of impacted wisdom teeth, if you don't take it out, so the food which is accumulating on it will do dental caries, and the pulpitis will happen. Then he will have severe pain. You are obliged to do the surgery. But in this case, you are obliged to do, and you don't have to wait. Cyst formation. If any tooth, pulpitis, and after gangrene, if you don't treat it, the infection will go to the bone, and the body will start defending itself. It will do granulome. If you don't treat these tooth, the granulome will be grown and will turn to cyst formation. All right? This is called periapical cyst. We are going to take the lessons of the cyst, all right, in the jaw. Creation of food traps that always...
Կարող եմ 5 րոպեով Արտյոմը մինչև դուք բացատրում եք մի հատ այն պացիենտին վաննայի ուղարկել։
Հոստոնայի?
Հա։
Տոկա։ Okay, Toka, yeah. So please just leave the chair. Do you want to see a patient here? You come in my back, please. Yeah.
Doctor, how come is affected by a gangrene?
Gangrene?
Gangrene in the gum. It's happened.
No, gangrene will be inside. Yes, it could in the bone beef, in the
In bone
bone
or in
and
the
soft
gum?
Yes, in the soft
Gum is
tissue.
soft tissue.
Yes, but first it will come out the apex of the root. This is the gangrene. The bacteria.
The gangrene need the